Emergency first aid and treatment. This is the given topic for us today. So the contents are in the introduction to emergency first aid and treatment, the wounds, shock, burns, first aid kit, disinfectant versus antiseptics, antibacterial agents. Introduction. So first aid and treatment. First aid refers to medical attention that is usually administered immediately after the injury occurs at the location where it occurred. It often consists of a one time short term treatment and requires little technology or training to administer. Treatment is something that healthcare providers do for their patients to control a health problem, lessen its symptoms, or clears it up. Treatment can include medicine therapy, surgery, or other approaches. So, the first one is wounds. What is wounds? Wounds is a break in the skin or other body tissues caused by injury or surgical incision. In other terms, cut. The first aid for wounds would be wash the wound under a strong stream of soapy water. This helps avoid infection. Second is to stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean bandage or cloth and elevate the wound until it stops bleeding. Clean the wound. Rinse the wound with water, keeping the wound under running tap. It will reduce the risk of infection. Wash around the wound with soap, but don't get soap in the wound and don't use hydrogen peroxide or and use, I mean, hydrogen peroxide or iodine which can remove irritating. Remove any dirt or debris with a tweezer cleaned with alcohol. Next is apply antibiotic or petroleum jelly. Applying a thin layer of antibiotic ointment or petroleum jelly to keep the surface moist and it helps prevent scarring. Certain ingredients in some ointments can cause mild rash in some people. If rash appears, stop using the ointment. Next is to cover the wound. Apply a bandage or rolled gauze held in place with a paper tape. Cover the wound keeps it clean. If the injury is just a minor scrape or scratch, leave it uncovered. Change the dressing. Do this at least once or whenever the bandage becomes wet or dirty. In case you got a wound by a metal or a cut by a rusty metal, get a tetanus shot if you haven't had one in the past 5 years and the wound is deep or dry. Watch for signs of infections. See a doctor if you see signs of infections on the skin or near the wound, such as redness, increasing pain, drainage, warmth, or swelling.
Shock. Shock is defined as a state of cellular and tissue hypoxia due to either reduced oxygen delivery, increased oxygen consumption, inadequate oxygen utilization, or combination of these processes. Shock is a critical condition brought on by the sudden drop in blood flow through the body. Shock may result from trauma, heat stroke, blood loss, and allergic reaction, severe infection, poisoning, severe burns, or other causes. When a person is in shock, his or her organs are not getting enough blood or oxygen. If untreated, this can lead to permanent organ damage or even death. Signs and symptoms of shock vary depending on circumstances and may include full clammy skin, pale or ashen skin, bluish tint to lips or fingernails, or gray in the case of dark complexions, rapid pulse, rapid breathing, nausea or vomiting, enlarged pupils, weakness of fatigue, dizziness or fainting, changes in mental status or behavior such as anxiousness or agitation. If you suspect a person in shock, call 911 or local emergency number. Then immediately take the following steps. These are the steps in shock. First aid, shock first aid. Lay the person down and elevate the legs and feet slightly. Unless you think this may cause pain or further injury. Keep the person still and don't move him or her unless necessary. Begin CPR if the person shows no signs of life, such as not breathing, coughing, or moving. Loosen tight clothing and, if needed, cover the person with blanket to prevent chilling. Don't let the person eat or drink anything. If you suspect that the person is having an allergic reaction and you have access to an epinephrine autoinjector, use it according to its instructions. If the person is bleeding, hold pressure on over the bleeding area using towel or sheet. If the person vomits or begins bleeding from the mouth and no spinal injury is suspected, turn him or her onto a side to prevent choking.
Burns. Burns are tissue damage brought on by heat, chemicals, electricity, radiation, or the sun. First degree burns and most second degree burns heal with at home treatments. Third degree burns can be life threatening and require specialized medical care. Degree burns are mild. The top layer of epidermis painful but doesn't typically blister. Second degree burns. It affects skin tufts and lower layers of dermis. You may experience pain, redness when blistering. The third degree burns. It affects all three dermis and the fat. Burn follicles because third degree nerve endings. You probably won't feel pain in the area of the burn itself, rather adjacent to it. The appearance. First aid in treating minor burns. First is cool the burn. Hold the area under cool hold up. If burn is on the cool until the pain is out, put off out for few areas.
Konchapi ka.
Don't break blisters. Blisters help protect against infection. If a blister does break, gently clean the area with water and apply an antibiotic ointment. Apply lotion. After the burn is cooled, apply a lotion such as one with aloe vera or cocoa butter. This helps prevent drying and provides relief. Ensure the burn with clean bandage. Wrap it loose to avoid your on burns. Bandaging keeps air off the area, reduces pain, and protects blistered skin. Initiatives such as ibuprofen or acetaminophen. Protect the first aid in treating major burns. First is protect the burned person from further harm. If you can do so safely, make sure the person you're helping is not in contact with the source of the burn. For electrical burns, make sure the power source is off before you approach the burn It's begin cover the bird with gauze or a clean raise the burn area. Leave the wound above tracks, weak and shallow breathing.
First aid kit. First aid kit, we never know when you might need to provide basic first aid to prepare for the unpredictable, considering storing a well stored first aid kit in your home and car. It also a good idea to have a first aid kit available at work. So first aid kit is very important in an emergency as they reduce the risk of minor injuries from worsening. One of the content of the first aid kit is an absorbent compress or dressing or the ghost pad. Ghost pad is used for general cleansing, dressing, prepping, packing, and the breathing wound. Second is the adhesive bandages. Example of adhesive bandages are the leukoplast or in a small cuts, we can also use the band-aid. Adhesive bandages protects the wound or scab from bacteria, damage, or dirt so that the healing process of the body is less disturbed. Next is the antibiotic ointment. Antibiotic ointment is very important to have in our kit because this is the immediate to apply in the open cuts or wounds. Example, if this is the dermamycin or the bacitracin, or for example, in the case of burn, we can use the silver sulfadiazine or the brand name is the flamazine cream. And then the next is the antiseptic wipes. Antiseptic wipes, it consists of adhesive alternative to cotton or wool used as antiseptic. This antiseptic wipe is also it contains an alcohol to sterile the uh, antiseptic wipes. And then the other one is the breathing barrier. Breathing barrier is a device made in administering or in administering the CPR. CPR stands for the cardiopulmonary resuscitation. For the first aid to for the first aid responder to reduce the risk of infection. It is also protect the victim from getting any communicable disease or getting from the rescuer. Another is the instant cool compress. This is used to prevent this instant cold compress will apply to prevent the swelling or the inflammation And then the other one is the non-latex gloves. Non-latex gloves are, this is disposable. And this is one of the universal precaution is wearing of gloves or non-latex or the surgical gloves to prevent the spread of disease or to prevent the contamination because as a rescuer, we need these gloves to prevent the occurrence of infection or contamination to the wound of the victim or to the wound of the clients. So another is the thermometer. Thermometer, it is used for to detect if there is an elevation of the body temperature, to test if there is a fever. And it is very important to know because sometimes when the patient is suffering from high fever, so we can detect through the use of this thermometer. And if we if we detect if there is an elevation in the body temperature, we can also give immediately the paracetamol. We know that paracetamol is non-prescription drug to uh, to lessen the fever of the client or the victim. So another is the triangular bandages. Triangular bandages, it is used for to support or to apply or to put into the affected areas. And then it also include in the kit are the emergency drug. Emergency drug, for example, clonidine or the catapress. If there is an history of the hypertension of the victim, of course we assess the victim. So we can also give the if we can see if we see that there is an elevation of the blood pressure of the patients of the victim, we can give the clonidine or catapress under the sublingual. So and then included also in the kit are the betadine to to cleanse the wound of the victim, the hydrogen peroxide to wash or the flush the dirt into the dirt from into the wound coming from the wound. So it is very important to have this also. And also additional is yung mga pads, especially if there is an if there is a fracture, we can also provide yung kung wala is yung pwede yung karton na nakat ganun to support yung break bones ganun. And then the other one is yung distilled water. Of course, we also include in the kit the distilled water in order for the victim, especially when taking the medicines. And then we also check. We always check the content of the first aid kit. Baka expired na yung mga nandoon. So once in a while, dapat sina-check din natin yung ating laman ng first aid kit natin. And then we encourage every household that they have this one, kahit ano lang, isa lang. In case of emergency, meron tayong magagamit kaagad. So that's the content of the first aid kit. Thank you.
Disinfectant and antiseptics. So antiseptics are both widely used to control infections. They kill microorganisms such as bacteria, viruses, and fungi using chemicals called biocides. Antiseptics are used to prevent the growth of microbes on living tissues, while disinfectants are used to kill the microbes on non-living objects. Antiseptics doesn't cause any harm to living tissues, while disinfectant cause harm to the tissue as it is toxic in nature. In antiseptic, phenol has a concentration of 0.2, while in disinfectant, phenol should has a concentration of 1. Proper use of disinfectant. Disinfectants have to be used properly to be effective. Some factors that need to be considered are if the disinfectant works against the microbe you're targeting, if the disinfectant is at the right concentration, how long the disinfectant needs to remain on the surface, the disinfectant's expiration date, cleaning the area before you disinfect, proper level of water temperature, water hardness. If the disinfectant is safe to use on the surface you're disinfecting, and precautions to protect yourself from hazards. Antiseptics are classified by their chemical structure. All of them kill or slow the growth of microbes on your skin. Some are better for specific purposes than others. Several types of these are ethyl alcohol and isopropyl alcohol, halogenated phenol derivatives, chlorhexidine and other diguanides, antibacterial dye, peroxide and permanganate, and quaternary ammonium compound. Ethyl alcohol and isopropyl alcohol is used to disinfect your skin before needle sticks and in hand sanitizer. These are also the most common antiseptic. Halogenated phenol derivatives is used in cleaning solutions and medical grade soaps. Chlorhexidine and other diguanides is used before operations. Antibacterial dye used to treat burns and wounds. Peroxide and permanganate used as a mouthwash and to disinfect your skin. Quaternary ammonium compound is used as a skin disinfectant. Antiseptics are used for a variety of reasons. Some of their most common uses are washing, preventing infections in minor wounds, disinfecting skin before surgery or other medical procedures, and disinfecting mucous membranes before a medical procedure. Antibacterials. Antibiotics, or also known as antibacterials, are defined as chemical substances produced by various species of microorganisms such as bacteria and fungi, which in low concentration destroy, kill, or inhibit the growth of other species of microorganisms. Antibiotic word was derived from two Greek words anti meaning against and bios meaning life. It means antibiotic are those drugs which work against bacterial life. There are different classification of antibiotics. First is classification based on chemical structure. Bilactam antibiotics containing bilactam ring and non-lactam antibiotics which do not contain bilactam ring. Classification based on sources. There are two, which is the natural antibiotics. These antibiotics are obtained from various natural sources. And semi-synthetic antibiotics. These antibiotics are commercially synthesized by adding chemical compounds to the natural compound. Classification based on spectrum. Antimicrobial spectrum is the scope that a drug kills or suppresses the growth of microorganisms. First is the narrow spectrum antibiotics. These antibiotics having a high degree of specificity. They are selectively effective either on gram-positive and gram-negative bacteria. Broad-spectrum antibiotics. The antibiotics which are effective on large number of pathogens, not only gram-positive and gram-negative bacteria, but also affect intracellular organisms like viruses and rickettsia. These drugs have a wide antimicrobial scope. So, in simple terms, narrow-spectrum antibiotics acts against a limited group of bacteria, while broad-spectrum antibiotics act against a larger group of bacteria. Another Another classification is based on mode of action. Bactericidal antibiotics, they destroy or kill harmful bacteria, and bacteriostatic antibiotics stop or slow the growth of harmful bacteria.